Everyone, and welcome to our webinar this morning. My name is Olivia and I am a project officer here at Kidsafe WA, and this morning we are joined by Ola from Connectivity. Thank you everyone, whether you are watching live or whether you are joining us via our recording. Thank you so much for joining us this morning. Just a few housekeeping items before we begin. The webinar will run for approximately 45 minutes. And if you do have any questions, please save them until the end and we will have time to go through them later on. I would firstly like to begin by acknowledging the traditional custodians of the land that we are meeting on today. This morning, I am recording from our office in Kidsafe WA in West Leederville, which is the land of the Whadjuk Noongar people. I would like to pay my respects to elders past, present and emerging across Western Australia and from where you are listening in from today. So, who is Kidsafe WA? For those of you where this is your first interaction with Kidsafe, we are the leading not-for-profit organisation. We are funded by the Department of Health WA, and we are dedicated to promoting safety and preventing childhood injuries and accidents in Western Australia. And we do this through education, advocacy, and through research as well. We do know that injuries are the leading cause of death amongst Australian children. And we know that more children die from injury than from cancer, asthma, and infectious diseases combined. Over 24 Western Australian children die every year from preventable injuries, while a further 8,000 are hospitalised. So many of the deaths and injuries we do see can be prevented, and there's lots we can be doing, as parents, coaches and carers, to really reduce the risk of those injuries happening. And focusing on Western Australia now, we know that roughly 35,000 kids do present to Perth Children's Hospital Emergency Department every year. And unfortunately, as we did mention, we do see roughly 24 deaths per year from injury. Now, looking at injury location, we do know the home sees quite a lot of injuries across all ages, as we know kids do spend quite a lot of time in those areas. And as they get older and they start going to school and engaging, with sports and recreational areas, we do see quite a lot of injuries there as well, which does sort of lead us nicely into the content we will be discussing in today's webinar. And speaking of sports, we have sort of identified the top 5 sporting injuries that we are seeing amongst young children. So number 1, we're seeing fractures most often, and this is followed by sprains and strains and also bruises and bumps. The 4th most common injury we do see is head injuries, which again does sort of lead us nicely into the content we will chat about today. So I'm sure you're all aware of the many benefits of physical activity for little ones, but just to reiterate, sport and physical activity are a really, really important part of childhood development, which really does allow children to improve, their physical, cognitive and social skills with others. These injury risks that we have just discussed are often perceived as a barrier to participation. So unfortunately, fear of injury can prevent children from engaging in sports and therefore reaping the benefits associated with physical activity. Particularly in adolescence, we do sort of see that drop off again in engaging in sports. So it is really, really important that we are making sure, to prevent those injuries and making sure children are engaged in sporting activities. So I will now pass over to Ola from Connectivity, who will chat to you today about concussions.
Wonderful. Thank you so much for inviting me today. As Olivia said, my name is Ola and I'm the Research Associate at Connectivity Traumatic Brain Injury Australia. We are also a not-for-profit that works in the community to raise awareness about traumatic brain injury in general, but also concussion. So in today's presentation, sorry, my slides. There we go. So we'll be covering a number of topics about concussion. So first of all, we'll start off by talking a little bit about what a concussion is, how to recognise concussion, concussion management and recovery. I'll also touch upon returning to activity in sport and persisting post-concussion symptoms, as well as further education opportunities to learn more about concussion. The focus of today's presentation will certainly be sports-related concussion. However, given that Kidsafe is an organisation that looks at child safety across the lifespan, I will also be touching upon concussion more broadly and relating to younger children as well where appropriate. So we're going to be looking at the whole spectrum today. So first of all, what is a concussion? So concussion is a type of head injury that temporarily affects how the brain works. Generally speaking, the injury and the damage that occurs isn't permanent, but that doesn't mean it's not an injury that should be taken seriously. Concussions can occur as a result of a hit, bump, or blow to the head, neck, or body, and they occur as a result of a forceful external impact that causes the brain to shake inside the skull. So I've got a quick video here that illustrates that it's the impact that occurs from an external force that causes the brain to shake within the skull. So this can also occur when there is a quick back and forth motion of the neck. So that kind of brings us back to the idea that concussions don't just result from direct hits to the head, they can also occur as a result of a hit to the neck or the body. And at this point, I did want to point out that you do not need to lose consciousness to have a concussion. In fact, most of the research shows that up to 90% of all concussions do not involve a loss of consciousness. So concussion has certainly received a lot of attention, particularly in the popular media recently, and it's often spoken about in the context of sport. So while we often associate concussion with sports, research in Australia shows that only about 16% of all concussions occur as a result of a sporting or recreational activity. In fact, it's much more likely that a person, be it a child or an adult, will experience a concussion as a result of a fall, motor vehicle crash, workplace accident, or assault, including family and domestic violence. And this also includes things that like shaken baby syndrome. Looking specifically at sport, there are a number of ways that a child or a young person might experience a concussion. This can include things such as a collision with another athlete, so a teammate or an opponent. They might experience a concussion as a result of contact with an object or a piece of equipment. For example, they might collide into a goalpost or get hit in the head with a ball, or trip over and make impact with the playing surface. Or people may also experience a concussion as a result of a fall or wipeout from a height or involving speed. For example, as may occur as a result of participating in equestrian sports, gymnastics, cycling, and the like. So at this point, I just wanted to point out that concussions aren't something that occurs uniquely in contact sports. They can occur as a result of non-contact sports as well. So now that we know what a concussion is, how do we go about recognising one? So there are a number of different signs, symptoms, and red flags that we can look out for when we think someone may have experienced a concussion. These terms are often used interchangeably, but they actually mean slightly different things. So signs refer to things that we can see a person experiencing. For example, we might see someone stumbling around or having balance issues. Symptoms, on the other hand, are things that people tell us that they are experiencing. So we can't see a person having a headache, but they may tell us that they're not feeling well or have a headache. Red flags, on the other hand, these are both signs and symptoms, but these are the things that we really want to pay attention and look out for because these may indicate more severe injury. And it's important to remember that signs, symptoms, and red flags can take time to develop, meaning they don't always show up immediately after a concussion. They might actually take a few hours and even sometimes days before they show up. So I'm going to go over the red flags of concussion because these are the things that may indicate more severe injury and require medical attention. And they're often things that perhaps people aren't necessarily aware of. So I think they require a bit of attention today. So examples of red flags that a person may experience or report experiencing when they've had a concussion include things like severe or increasing headache, loss of consciousness or worsening conscious state. They may experience changes to their alertness and be drowsy or hard to wake up, specifically in younger children. You may see someone having a seizure or convulsion, unequal pupil size, or they may report experiencing blurred or double vision, repeated vomiting, continuous bleeding, or a clear fluid discharge that occurs from the ear or nose. Neck pain or tenderness is particularly important to look out for because this may indicate that a spinal cord injury has also occurred. Weakness or inability to move the body as usual, decreased coordination, different sorts of sensations relating to numbness or tingling or burning in the arms or legs, increased restlessness, agitation or confusion, skull fracture or break, or bruising on the face or neck, especially if the person is known to be on any sort of blood thinning medications. So signs and symptoms, as we can see, there are quite a number here. I won't go over these all. However, I just wanted to point out that, like we mentioned before, that signs and symptoms may appear immediately after the injury, or they may take some time to develop. Examples of immediate signs of concussion include the person not taking any protective action when they're falling to the ground or stumbling when they get up, or you may also see the person grab or hold their head or have slurred or incoherent speech. Immediate symptoms, on the other hand, can include things like headaches, dizziness, confusion, memory loss, or feeling tired, nausea, or vomiting. Whereas delayed symptoms that might occur include persistent headaches, difficulties remembering or concentrating, sensitivity to light or noise, or feelings of sadness or anxiety. So I appreciate that there was quite a lot of signs and symptoms covered on the previous slide, but it can be helpful to think about these signs and symptoms of concussion clustering in these 4 categories. So these can include physical signs and symptoms, which include things like headaches and troubles with balance or coordination. For others, after they've had a concussion, the symptoms can be more cognitive in nature, so that might affect their thinking, remembering, concentration skills, and the like. For others, it's more of a sleep profile, so people may experience changes to their usual sleeping patterns. For example, they might sleep more or less than they usually would. And for others, it's an emotional sort of presentation where they may feel more agitated or depressed or anxious, or if they already are experiencing these mental health disorders previously, their problems might be a little bit worse after the concussion. And how about spotting concussion in infants and toddlers? So this can be particularly difficult because young children may not have the language capacities to tell us exactly how they are feeling or what they've experienced. So that's why it's important for us to pay attention to changes in behaviour and look out for generally physical signs of injury that may have occurred. So possible indicators of concussion in young children include complaints about head hurting or holding their head, touching the head, rubbing it. They may be vomiting more than usual, experience unsteady walking or loss of balance, poor coordination, changes in nursing and eating or sleeping patterns, loss of interest in favourite toys, or be more cranky, irritable than usual. Or you may notice that they are more sensitive to light or noise, or tiring easily. In addition to the red flags that we covered a few slides ago, we'll also want to look out for things like raccoon eyes, which are exactly as the name suggests. They look like really dark kind of bruises under the eyes, or battle sign, which is a bruise behind the ear as well, which can indicate a more severe head injury has occurred. So with all this in mind, there are a few things that we need to remember about concussion, in particular that no 2 concussions are alike. Each concussion is a unique injury, meaning that a person can experience different signs and symptoms, even if they've had a concussion before. Also, just one sign or symptom is enough to be diagnosed with a concussion. And as we mentioned before, signs and symptoms can, of course, take time to develop. And it's always important to seek medical attention if we have seen or suspect a concussion has occurred. How do we respond to a concussion? So if we have seen a concussion occur on the sporting field, or we suspect one has occurred, even though we may not have been present to witness it, the first thing we want to do is to determine whether or not the situation is a medical emergency. And we do this by removing the individual from what they're doing immediately, so stopping play or stop playing on the playground, whatever it might be. And then we'll follow the basic principles of first aid, so your doctor's A, B, C, D. Then we will assess for red flags. If no red flags are present, we will continue, and because we want to determine whether or not it's a concussion. So we will be looking for concussion signs and symptoms. There are a number of tools that we can use to help or refer to assess signs and symptoms. These include things like the concussion recognition tool, which is basically a check sheet that was produced by the Concussion in Sport group, which is a leading group of researchers from all around the world who get together periodically to review the research and create guidelines as to how sport concussion in particular should be handled. They've got a great tool to identify different signs and symptoms of concussion. And there's also the Head Check app, which was produced by the Murdoch Children's Research Institute in Melbourne. And so that's a handy app to have on our phones to, again, assess the signs and symptoms of concussion. If there's any health professionals attending the webinar today, I just wanted to point out that there is also the Sport Concussion Assessment tool. Once we have, the next step is to take the person to a hospital or their local GP for a medical assessment. So there are a number of tools that doctors and other clinicians can use to help them to identify concussion. These include the Clinician Assist WA, which was previously known as WA Health Pathways, but there's also the Sport Concussion Office Assessment tool. So this was produced by the Concussion in Sports group that I mentioned previously. So even though this particular tool is specifically designed for healthcare professionals, it is something that is publicly available. And I encourage people to take a look at it because it basically provides doctors with a standardized sort of way of assessing someone who's had a concussion, and it covers a lot of interesting things that might help trigger. Sorry, I just had a bit of a connection issue there. To encourage people to have a look at beforehand to identify any questions that they might have that they would like to discuss specifically with their doctor or health professional. So I've just got an illustration here of what the concussion recognition tool and head check app look like. The concussion recognition tool can be downloaded from the Connectivity website, and the head check app can be found on Android and Apple iStore. So how do we manage a concussion? So concussion management is generally broken up into two parts. So we've got the initial management, so things to do in the first 24 to 48 hours after a concussion has occurred, and then 48 hours onwards. So the first 24 to 48 hours after a concussion has occurred is a period of relative not strict rest, meaning that the person can continue to engage in activities of daily living. So, for example, walking, cognitive activities, light physical activity is permitted as long as it doesn't make their symptoms more than mildly worse. But during this point in time, we still want to be avoiding activities that can result in a fall or another hit to the head, which could result in another concussion. You may have previously heard that after a person's had a concussion that they should just rest or be kept in a dark room. That is outdated advice that is no longer recommended. In fact, complete rest and prolonged periods of rest have not been found to be beneficial and may even delay concussion recovery. In the first 48 hours, we also want to continue to look out for red flags and seek medical attention if they do develop. It can also be helpful during this time to keep a diary of any signs or symptoms that the person's experiencing, noting the duration, the severity, and if anything in particular might trigger the signs and symptoms. For pain relief, paracetamol and ibuprofen can be used to manage pain, and we encourage people to just follow the packet instructions. It's best not to use things like aspirin because this may increase risk of complications because of the blood thinning effect that they have. And if your child or young athlete is on any other prescription medications, it's good to check in with the doctor for advice on how to manage those. Ice packs can also be used to relieve pain. However, it's not advised to use heat packs or gels for pain relief during this time. Sleeping, it's perfectly fine for a child or a teen to sleep after a concussion. There's also no need to wake them. However, it can still be a good idea to check in on them regularly, look out for those red flags in case they've developed. And for young children in particular, it's a good idea to try to maintain normal routines for sleeping, nap time, bathing, and the like. If, for example, a young person has experienced a sports-related concussion, it's best not to, and are driving, it's best not to drive for at least 24 hours after the concussion, and to seek medical advice for clearance. Do not allow the person to ride a bike home or drive their car. An alternative transportation may be required. And similar precautions should be taken, for example, if the person is taking any practical skills-based classes at school or at an apprenticeship. Flying, it's also a good idea to avoid flying during this time. There is a little bit of evidence to suggest that flying during this time may have a negative effect on recovery, and this has to do with difference in pressures in airplane cabins. However, I think the most important thing here is that we're trying to avoid a situation where a person might develop red flags mid-flight, where it would be difficult to get immediate medical attention. Cognitive activity, on the other hand, during this time is okay, as long as it doesn't make symptoms worse. However, screen time should be limited for the first 48 hours after injury. It's not advised to allow children or teens to participate in contact sports during this time. However, light physical activity, such as walking or stationary bike riding, is okay, as long as it doesn't make symptoms more than mildly or briefly worse. And it's same goes for alcohol and other drugs. It's best not to, or it's sensible for children not to drink or smoke cigarettes, vapes, or take sleeping pills or recreational drugs during this time, because this can make symptoms worse and also make it difficult for others to tell whether the concussion is affecting them or not. After the 48-hour period, we want to be gradually returning to activity. So we don't want to return to things all at once, because this can potentially trigger or worsen concussion symptoms and potentially lengthen the period of recovery. Instead, we want to gradually increase the duration and the intensities of recovery over time. So start by introducing less demanding activities before attempting harder ones, and pacing activities to include regular breaks and special accommodations. Naps should also be kept to a minimum. They are unlikely to help recovery, and regular sleeping habits are encouraged to be maintained. So Connectivity has developed a number of resources, including a suggestion for guidelines of how to return to learn and to return to sport that follow this graded approach to returning to activity. And we encourage you to check out our website if you're interested in having a further read of those. So what should we expect when it comes to concussion recovery? Well, generally symptoms should decrease over time, but they can return, worsen, or new symptoms may appear as new activities are introduced. Recovery can, of course, fluctuate, where an individual might be doing well one day, but not the next. If this does happen, it's best to return to a lower level of activity that doesn't worsen the symptoms. And it's completely possible for a person that may need to move back to a stage more than once during their recovery. And a person is considered to be fully recovered when they are no longer experiencing any symptoms and are back to functioning at their pre-injury levels. So I just wanted to touch on a little bit about the AIS position statement about returning to sport. This is something that came out at the beginning of February last year, and they've given a recommendation of how to return to sport for people under the age of 19 without a dedicated healthcare practitioner. So they basically recommend that a person needs to be symptom-free for at least 14 days at rest before returning to contact training, and they should not return to competitive contact sport until a minimum of 21 days, so 3 weeks from the time of their concussion. To be clear, this is not 14 days from the time of concussion, it's 14 days from when the athlete becomes symptom-free. So the day that the concussion occurs is deemed to be day 0. So this position statement can be quite a lot to digest, but basically what it means is that the person needs to be symptom-free at rest for 14 consecutive days before they can go back to contact training. The person can participate in low-intensity, non-contact exercise following their concussion, as long as it doesn't make their symptoms more than mild or briefly worse. And this is in line in those recommendations that we spoke about a few slides ago. After 14 days of being symptom-free at rest, the person can go back to contact training, but they must still wait at least 21 days before they go back to participating to an organised competitive contact sports event. Your club or sporting code may have its own recommendations, so it's best to check to see if there's varies from what the AIS recommend. Now, what do we do if our child is not recovering? So when it comes to concussion recovery, most people, this includes children, adolescents and adults, will recover within 4 weeks of their injury. However, a small proportion of the population may go on to experience symptoms beyond this typical recovery time frame. When this happens, the person is said to be experiencing a condition known as persisting post-concussion symptoms, or PPCS. The literature indicates that about 33% of children under the age of 18 may experience PPCS after a concussion injury. At this point in time, we don't really know who will go on to develop persisting post-concussion symptoms. However, there is a lot of research underway that's investigating a number of ways to identify who these people can be. What we do know so far from the literature is that a number of risk factors have been identified for persisting post-concussion symptoms, and this includes females, especially in the ages of 15 to 18 years. There may be some biological differences for this, for example, differences in brain structure and function. However, it might also relate to societal norms. For example, females may be more likely to simply talk about or admit that they are continuing to experience symptoms. Other risk factors include family history of migraine or headaches, pre-existing mental health problems such as anxiety, learning disabilities, attention deficit hyperactivity disorder, psychoactive drug use, and personality traits. So, for example, children who tend to be more high achievers or exhibit a rigidity of thought may go on to experience persisting post-concussion symptoms because they might find it quite distressing when they aren't recovering, and it just kind of creates a negative cycle that impacts their recovery. What can we do to prevent concussion So there's a number of things that we can do to prevent a concussion around the home or on the sports field, even though concussions themselves cannot be completely eliminated. Around the home, we can supervise young children whilst they use ramps or play on climb-on bounce equipment. We can remove or secure any loose mats to prevent falls, especially when children are learning to walk. Installing or using aids that can assist in preventing falls if appropriate. And one that's often overseen, but a very easy one to do, is making sure that children wear properly fitted shoes. On the sports field, ways to prevent concussion include respecting and following the rules of the sport, especially rules that are in place to reduce hits to the head, as well as making sure that our children train, practice, and play in ways that are appropriate for their skill level. So the Connectivity website is an information hub for both community and health professionals alike, and we have a number of fact sheets, health guidelines, and free online courses that we encourage everyone to check out if they'd like to learn more about concussion. We have a number of short online courses, which include our original concussion course, which is for anyone who has an interest in concussion. We're currently in the process of updating it, so it might be a good idea to come back to that in a few months. But if you'd like to learn more about sports-related concussion, we have a very short 15 to 20-minute course that's been specifically designed to educate first responders to a sports-related concussion. So this applies to coaches, trains, referees, umpires, parent volunteers, and first aiders. And we also have one that looks at the other end of this age spectrum and covers concussion in older adults. And that's it from me. If anyone would love to connect with us, we have a number of ways that we can be reached.
Beautiful. So just to wrap up today, thank you again, everyone, for listening in. We really do recommend going back to, whether it's your sporting club or your school, any sort of, community organisations, and reviewing those concussion protocols, sort of making sure all the information's up to date. And as Ola mentioned, any coaches, first aiders, sort of important people like that, making sure they are aware of any changes to those protocols. We also do recommend checking out both Kidsafe WA and Connectivity's websites. As you could see in the slides there, Connectivity has a bunch of really amazing and useful resources. So we highly recommend having a look online and sort of engaging with those resources there. And lastly, just following Kidsafe WA on Instagram. We do post any future webinars that we may be running, and we also post quite a few injury prevention messages, any future workshops we have, that sort of thing. So we do highly recommend sort of having a look there as well. As I said, at Kidsafe, we do offer a whole bunch of resources. We do have a safety demonstration house at our office in West Leederville. So if you do have young children and you are sort of looking at ways to make your home nice and safe, you can come through and have a look there. We also offer a child car restraint hiring, checking, fitting, and advisory service. So again, if you do have younger children, you can come to us and we can help there. And we also do quite a few playground audits as well for organisations. So if you do have a playground and you would like to get it checked, we can come out and help with that as well. As I said, please do follow us on Instagram, and we would really appreciate any feedback on today's webinar. So you can just scan the QR code there, and there's just a few feedback questions that you can fill out, which, as I said, we would really appreciate any feedback on today's webinar. So that is it from us here at Kidsafe and Connectivity today. If you do have any questions, please feel free to pop them in the chat function below, or you can reach out to us at a later date with any questions you have. As I said, thank you again to Ola from Connectivity and anyone listening in for joining our webinar today. And hopefully we will see you at the next one.